Hey guys, Dr. Mo here, and welcome back to the channel where we discuss health, wealth, and everything else. As you guys know, in the United States and abroad, mental health is a big deal. And there's such a shortage in mental health resources available across the globe. But in the African American community, the lack of available resources is unbelievable. In this particular clip, I want you guys to just take a look and see why it's so important that we get the mental health that we need, and especially for our children. Take a look at these signs, guys, because these are the signs that many times it goes unnoticed, and it's only when our children or our siblings or our family or even us experience a catastrophic situation that we recognize that there is such a need for mental health in our community. This is not a black, white, or Asian thing. This is a society thing. This right here affects our society as a whole. So it's in everyone's interest to make sure that we're doing all we can to make sure that everyone gets a fair shake at getting the adequate mental health services that they need. Take a look at this clip and let me know what your thoughts are. Let's get into it.
Tonight we've reported on the troubling rise in suicide deaths among young Black Americans. Tonight, we explore one of the drivers of that crisis, a shortage of mental health providers. Special correspondent Fred DeSam Lazaro has this report from Chicago, part of our Race Matters coverage. And a warning, this story discusses topics of suicide that some may find disturbing.
Feeling like you're not the regular type of person, it could shift your mind into a really dark place. And I was, 9, 10, just like, I don't even want to be here anymore. Because I just didn't.
You thought about ending your life?
Yes.
When Noah Boynton was growing up on Chicago's South Side, he had trouble brushing off the teasing he faced at school. He had a condition that affected how he ran and the appearance of his leg. Sharon Morgan, Boynton's single mother and a teacher herself, initially thought the taunts were mostly harmless, but later she received a call from the mother of her son's best friend.
He went home and was like, "Mom, Noah's having these thoughts." And I just remember the night me and my mom were sitting crying together because it was time that I actually told her how I was feeling. I didn't want to be gone, but I just couldn't take it anymore, and it gets to that point.
He started therapy, but in 2022, Boynton's grandfather, Morgan's dad, died at the age of 87.
He was so good with my son. It was the things. He gave the things that I couldn't.
A lot of people don't grow up with that father figure in their life to show them just how to become a man. He was that guy for me in the end. Losing him was, in a sense, we both lost a father in that way.
Morgan started to see more troubling signs in her son, including increased isolation. She decided to seek help specifically from a Black male therapist.
Guys, I want to just bring out some awareness to this. As you can see, this young man was exhibiting signs of isolation. He also was extremely sad. He was grieving. Not to mention the things that he encountered as a result of just being a student in school. That's why it's so imperative that we are vigilant when it comes to our children and the children of others. You know, this particular mom didn't realize that her son was going through a lot early on. It was his friend's mother that reached out to her. If you see something, guys, we have to say something, even if it's not our child. But if we recognize it, we need to say something to the appropriate guardian for that child or to our friends and family as it pertains to what you're witnessing that person experience. I think it's our duty to each other to make sure that these things are brought to the forefront, just as this particular kid's mother did for him. And in addition to that, take a look at people around you when they're losing family and friends. It has an impact. And it could be you. Let's keep watching.
Black men handle emotions differently, and I wanted someone who could understand how Noah was feeling and help him navigate through that.
A kid or a client, right? They don't care what you know until they know that you care.
They found Dwayne Smith, a licensed counselor. When he first met Noah Boynton, the two talked only about basketball, before slowly getting into conversations about feeling and emotions.
He understands, he gets it. His story is similar to anyone I know. You know, it's just things like that make it easier to...
There are things you don't have to explain.
Exactly. It's a lot of things that you don't have to say because they already get it.
It's definitely a big deal. It does matter. I think it brings a level of comfort, because one of the things that we all have in common, particularly of the African American community, is, we know some of the struggles, some of the fights, we all have had these encounters, being misunderstood, being labeled.
Smith works in schools, runs a summer program, and provides therapy largely to clients who live on Chicago's south and west sides, where many of the city's Black residents live.
It's a lot of work. There's a lot of need, and there's not enough people.
Experts say there is a lack of Black mental health professionals across the country, despite a growing demand for such services. In 2012, the city of Chicago closed half its public mental health clinics, mostly ones located on the south side. By 2020, according to one analysis, the provider-to-population ratio in some areas was about 1/10 of the national rate. Officials have announced plans to reopen at least one clinic and expand services elsewhere, but
there's still a great deal of work to do in order to ensure that those who are in need and at risk are receiving the support that could ultimately save their life.
University of Chicago professor Janelle Goodwill has studied the rise in suicide deaths among the city's Black residents, including youth.
When I speak with families who have already lost their child, or families who are currently living with the reality that their child is at risk for suicide, one of the main questions I'm asked is, how do I find a therapist? How do I find a clinician? How do I find a Black clinician in this area? And so I know that that's something that is really impacting so many families. And so there's a great need to ensure that there's enough providers available to service all those who are in need.
Guys, this is very profound here, a profound moment, because as a Black mental health provider, I understand exactly what's going on here, and I see it a lot, because I do come across quite a few Black clients who have exhausted themselves trying to find Black therapists or Black mental health providers, and they feel like they've been left behind. I want you guys to think about this and think long and hard that if by chance you can't find anyone that looks like you, be someone until you can find someone that looks like you. I know that therapy is important. Medication is important when you need it. Many times, because there's such a shortage in African American or minority therapists, because there's a lack of them, that may put you in a position where you don't get your needs met. And I want you to make sure that that is not the case. See someone until you can see someone of color or someone that you think that you can relate to. I think it's great when you can get mental health coverage from someone that looks like you, but in the interim, get help as soon as you can. That's the key. All right, let's get back into this video.
In 2020, licensed clinical social worker Kamisha Jones started Sister Afia Community Care. It provides free therapy specifically for Black women and girls, a population that's seen one of the biggest increases in suicide both nationally and in Chicago. Jones, who's dealt with her own mental health issues, says her clients rarely face just one kind of stress.
If a Black woman were to come to me and she's like, I'm taking care of my children, I'm also taking care of my parents, and I just feel really stressed and stretched really thin because of all these things that I'm juggling. Everything that we've been through in this country and we're still here is powerful, but all the things that we're growing through to still exist in this society is really, really difficult.
That, Jones says, is partly why it's so important to get more Black providers into the field. One barrier is licensure requirements. A 2022 report found that 84% of white people who took the licensed clinical social worker exam passed on their first try. For Black applicants, that rate was just 45%, and only 57% of Black applicants ever passed the test. So last year, the Illinois legislature passed a law allowing an alternative for obtaining a license, completing an additional 3,000 hours of supervised practice.
With where things are at right now with mental health in our communities and in this country, the more that we can open it up for people who really want to do this work, I think is a huge asset.
The effects of the change won't be seen for a while, but there are already calls to expand alternatives to other mental health professions. On the South Side, Noah Boynton, who followed his late grandfather, an Olympic boxer, into the ring, believes therapy after his death prevented him from taking the same path as some of his peers.
At first, when he passed, it was like nothing matters anymore. It's like, I don't know what to do. It's just you feel lost a lot. And when you feel lost like that, a lot of times demons find you. If I didn't get that help as fast as I did, I would have probably tried to jump in the streets or tried to be something that I'm not, because it helps you, it covers that up a little bit. It helps mask it.
As you hear it best from this young man, he's articulating exactly what many kids experience. It is imperative that we hear him and that we apply it and employ it in our daily lives as it pertains to the people that we know. It is so easy to fall in harm's way when you're not receiving the treatment that you deserve. I mean, it's that easy. Let's do better by making sure that we are good stewards of our resources and that we're helping our society, our brothers and sisters, and those that are around us. Making sure that not only our families are okay, but the families of others are okay as much as we can.
Today, Noah Boynton is happy. He just graduated from high school and is enjoying summer. He's getting ready for his first year at Morehouse College in the fall. He wants to become an entrepreneur, maybe build his own clothing brand. But he says he continues to work on himself.
The mental health battle is not something that's going to end. It's just something that you have to continuously want to win. It's not gonna ever really be over.
And as this crisis continues, he hopes sharing his story will encourage others to find the help they need.
Guys, you have it. You've watched the video. As the young man said, the mental health struggle will continue on. There will always be something that may challenge us in one way or another. So it's very important that we understand that sometimes we can't endure everything alone, and that we may need to get the assistance of a mental health provider to get us through some of those tough times. I will question you. How many Noahs do you know? Are you a Noah? How many Noahs are you providing some type of assistance or guidance to? If by chance you are not doing as much as you can, do a little more to make sure that you are okay, as well as the people around you. I think that this is a great example of how mental health treatment is needed in our community, but also what happens when you get good therapy and possibly medications. You guys let me know what your thoughts are down below.